Today I'm talking about Graves' disease and how we treat it holistically. Okay, so on the part 1 and part 2, I went into detail of how this disease is diagnosed, what is Graves' disease, how is it treated conventionally, what are the signs and symptoms that you can look for. We went into all that. So if you don't know any of those things, go watch part 1 and 2 of this video, and then let's talk about how do we address this holistically. Okay, so I remember having a meeting in my office where we invited patients to come in and just learn about thyroid and different, hormone related topics. And this patient came in and asked me this question. Doc, I have this test result and they're saying that I have both low thyroid and high thyroid at the same time. And they're getting ready to take my thyroid gland out, but I really don't want to, because I'm not even sure they got the diagnosis correct. Well, how can I have high and low at the same time? That was a great question, and it's a great question for this video. Why? Because as I'm about to go into the holistic treatment of this Graves' disease, you guys will understand that it doesn't even matter what the diagnosis is when it comes to autoimmune thyroid. Whether it's high or whether it's low thyroid function that we eventually diagnose, which means that do we diagnose Graves' disease as a high functioning thyroid, or do we diagnose Hashimoto's as a low functioning thyroid? It doesn't matter. The holistic treatment or the holistic approach is the same. Okay? What do I mean? Well, here's what to think about when you're treating holistically. Is the thyroid the problem? No. The thyroid is not the problem. The thyroid was an innocent bystander standing there, doing its thing, releasing hormones when it's commanded to, stopping the release of hormone when it's commanded to, increasing the release of hormone when it's commanded to. So the thyroid was working fine, and it's still working fine. Okay? The problem came from the immune system. The immune system is the one that started to attack by making antibodies against the thyroid. It decided to make some thyroid stimulating immunoglobulin in the case of Graves' disease, or it decided to make some thyroid peroxidase antibody in the case of Hashimoto's. So it decided to make these antibodies in this particular case that I'm talking about, this patient that asked this question. It made both. It made the TPO and the TSI. So what was going on? The thyroid was getting stimulated. It would stimulate it to make antibodies, to make thyroid hormone. Then it was stimulated not to make thyroid hormone. It was just all over the place, right? So when we checked this patient's blood work, yes, they were positive for TPO and they were positive for TSI. So the doctor said, guys, you got Graves and Hashimoto's. Wow. Okay, well, at this point, I don't know what to do. Let's just take this gland out. Wait. No. So I told the patient, let's not take your gland out yet. Tell your doctor to give us 3 months. Your endocrinologist. Tell them to give us 3 months, because why? In 3 months, I want to try to address all the triggers that you might have that might be triggering your immune system to attack your thyroid. So once we do that, if you're still positive for all these antibodies, you still have this thyroid issue, then we will use one of his conventional approaches, okay? So the patient was glad to hear that, because she didn't want to have surgery. She didn't want to take the radioiodine. She was not interested in the methimazole. She didn't want, PTU for sure, and she didn't want to go on beta blockers that are going to make her feel tired and gain weight. She's like, no, I don't want any of that. I'm already struggling with my weight. I want to try holistic. Okay, so we decided to embark on the journey, and that's all we did. Okay, so we started to address the triggers. So first thing is, let me see your mouth. We looked inside. Oh my gosh, she had a ton of silver fillings. Okay, multiple decay when she was younger. So she had dentists put a bunch of silver fillings in. So she's had those in her for over 15 years. So we had her go see a biologic dentist who can safely remove those silver fillings and replace them with the new composite that doesn't have any of those toxins and heavy metals in it. So check, we took care of that. Second thing, we tested her for viruses. We looked for cytomegalovirus. We looked for Epstein-Barr virus. We looked for HSV viruses. Okay, we treated, we found some of them positive, we put out a protocol, herbal protocol actually, to reduce those and get them down. Okay, so we checked out number 2. Number 3, we checked her for what? Other autoimmune diseases. We look for celiac, we look for type 1 diabetes, we screened her for lupus. I mean, we looked for, you know, a ton of different rheumatoid factors. We checked all that. Okay, the ones that came back positive, we started to address. Okay, so we got the autoimmune situation done. Then we look for food allergies and food sensitivities. What did we do? We checked for gluten sensitivity, gluten allergy. We looked for dairy sensitivity, dairy allergy. We looked for the allergies to corn, to soy, to just name it, right? We ran a panel of over 180 foods. Okay, we got them back. For her, gluten, dairy, she had to get off of. Okay, so we took her off of those, right? Then we put her through a detox. What does that mean? We poured a ton of nutrients in her body. If you haven't seen my video on the nutrients to use to treat low functioning thyroid Hashimoto's, that's the same exact one we used for her. Okay, we put her on those, all those vitamins, the B vitamin, the D vitamin. Of course, after we checked the levels to make sure she needed them, then we detoxed our body. We poured a ton of glutamine, L-glutamine in our gut to heal it, and we took care of all that. So gut healed, we put probiotics back in, prebiotics in there, we killed all the candida in our body, well, we treated them, and then we looked at the thyroid levels, okay? So with the thyroid levels, in her case, she still needed a little bit of support. So we put her on the natural thyroid, we call Nature Thyroid or NP thyroid. So that's what we used to bring her level up so that she can start losing weight. So she started losing weight, inflammation from all the excess body fat started coming out of her body, the toxins that was in her body from that, we started binding them, getting them out of the body. We got her on exercises that encourage lymphatic drainage, okay? Exercises like swimming, bungee jumping, like rebounders, like the Vibrasize machine, right? We got her on those so that she can start moving those lymphatics so they can start draining all the toxins out through sweat, through pee, and through the stool. So we got all those things done in those 3 months time frame, okay? And guess what happened? So we rechecked the levels, antibody levels were in remission. Yes, I said antibody levels were in remission. So she went back to the endocrinologist. She thanked them very much for helping her to find the diagnosis, but she was also very thankful that they gave her options, but she chose the holistic one. So she's kept her thyroid. We continue to monitor her. She's doing well. She's in remission. When her antibody level rises up a bit, she usually knows what caused it. She's got too much stress in her life. She's got to calm it back down. Okay, she does that, it goes back in remission. She stays on all her vitamins. She's sleeping well, taking care of herself, self-care, and she continues to do well by not needing surgery. Okay, so that was the treatment for this particular patient. For each patient, we have to weigh it. We don't know what's going to work for you, but we've got to find all of your triggers and then help you work through it to try to help you get better. Hope this has been helpful. So not all treatments of Graves' disease has to be surgical or even conventional. Okay, so holistic approaches work. We just have to work with someone that knows what they're doing and help guide you through getting those things done. And I hope this video has given you those checkpoints, things to do to work with your doctor on so that you can start working on those things and getting better from this disease. Hope that has been helpful. Share this video with someone you know. If you know someone in your family that's struggling with Graves' disease and all they've been given is a prescription medication to treat it, make sure they get this video, share with them so they can get better also holistically.